very good afternoon to all of you. I am Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be doing really good. Welcome to our special Insta Live. This session is dedicated on acne management. And acne isn't merely a surface issue. It's just not about the appearance. It's deep down, it affects our confidence level, our self-esteem, etc. Many times people go into depression because they have, chronic acne issues. So a holistic approach in the treatment is required when we are dealing with acne. So today the topic of this particular session is going to be acne management. Acne vulgaris is a chronic skin condition affecting more than 85% of the adolescents or young adults. We all know when we attain puberty, as a teenager or young adult or in the adolescence, we do have this phase of acne. Acne is about acne, and many times a lot of stigmas are also associated with acne. That's why today's live, is going to aim at how to manage acne. Our aim would be to find out how to prevent acne. B, in case we have acne, how to deal with it. And then we also have these, post-acne inflammatory pigmentation or scars or pits. So we'll also try to address that issue, how to take care of those scars and pits. And for that, we are going to have Dr. Ashwini Modi, a renowned skin expert from Mumbai. So today our skin expert is Dr. Ashwini Modi. She's a distinguished consultant dermatologist and cosmetologist based in Mumbai with over a decade of experience. She completed her post-graduation in dermatology from LTNMC and GH Science Mumbai, and achieving notable recognition with 3 gold medals. Dr. Modi is not only a skilled dermatologist but also a trained rapid transformational practitioner specializing in subconscious healing for chronic skin condition and self-esteem issues. She is also the author of the book More Than Skin Deep. A very warm welcome to you, Dr. Ashwini Modi. It's such a pleasure to have you with us today.
Thank you. Pleasure is all mine. Thank you for having me here.
So, Dr. Modi, today the topic of our conversation is acne. And acne is such a common chronic skin condition. Most of us have gone through that phase. So, it's very important to talk about it. To start with, first of all, we would like to understand what is acne, what are the various types of or grades of acne.
Yes, as you said rightly, majority of my OPD is with patients having acne, okay? And initially it used to come in teenage. Now I'm seeing acne in all age groups, okay? So that's very common now in adulthood also. So it's a very good topic, and I think there should be more such discussions so that people know what to do and what it is all about. So to start your question, answering your question, the acne, or also called as zits or pimples, is a chronic inflammatory condition which affects the pilosebaceous unit. Now, what is the pilosebaceous unit? Is we all have thin hair on our face, right? We have very thin hair on our face and also on our back and shoulders. And this hair follicle has a sebaceous gland attached to it. Okay, now a sebaceous gland is attached to the hair follicle inside the skin. And what happens is, if somebody has oily skin, okay, if there is some hormonal imbalance or because of diet and stress and all of that, sometimes the oil secretions becomes too much. So when the sebaceous gland is attached to the hair follicle and the opening is very small. So what happens if there's excess of oil, the pore gets clogged, okay, and which is why the secretions get accumulated, and at a point of time it actually bursts inside the skin, and that is when we actually see those acne. So it starts with a blackhead or a whitehead. So a blackhead or a whitehead should not be neglected because that is the first grade of acne. And if we neglect it at that time, then what happens? It just goes into the higher grades, wherein we get a papule, those red ones, and then we have sort of bacteria on our skin, okay, and that gets entry, which is why the pustules forms, okay. Then we have that grade 3 acne. And if somebody has a severe hormonal imbalance, then they form cystic acne. So this is how the acne goes.
Right. We see various patterns at times. Many times we see these small bumps over our forehead or alongside the jaw lines. Many times we see pimples or acne or just in our butterfly area, cheeks, and neck. Do they symbolize us something? Do they tell us something, these patterns?
Yes, they do. Okay, so if you see a lot of acne on the jawline, then there's definitely some hormonal imbalance there. So where then we look out for PCOD or excess of androgens and look out for serum prolactin or any other those hormones. Then if they are there on the forehead, so then we have to rule out any fungal acne. So we see if there is some dandruff issue happening or if they're using certain hair products which are very sticky or oily. So nowadays, a lot of kids love to use styling products on the hair, especially boys. So what happens is they clog the pores here, and that is when they get pomade acne. Also, so those are small comedones, whiteheads. Okay, and also if they- along the hairline, again we have to look for fungal acne. The cheek acne is usually diet related, lifestyle related, and also a lot of teenage acne comes on the cheeks. The nose acne, yes, it starts very early. Nowadays, I'm seeing kids as young as 8 to 9 years coming with acne or whitehead and blackhead on the nose. So, so the thing here is we should not neglect these because that's the starting stage. And here we can manage with a good cleanser, a good product that we can give the kid, and they can not then avoid going into the second or third grade of acne.
Right. So the whole approach should be to get it treated at the right time, which is in the initial stages. So don't let it get worse. Go to the doctor, go to a qualified dermatologist in case you have acne or any other skin issues. But then a normal practice of our society is to apply something on our acne, from the kitchen. We love applying basil, curd, garlic, toothpaste, everything that we get hold of. Then we have so many influencers who have so many quick fixes, for skin related issues. Then we have over the counter topical applications, medicines. बहुत आसान है chemist shop पे चले जाना और बोलना भाई आप pimple हो रहा है कुछ दे दो. And we love using those creams because initially they work wonderfully. And then after a certain amount of time we realizes that we are falling for it, or our skin is getting addicted to that particular skin, yeah, that cream. So my question to you is, doctor, what is your stand on these home remedies, quick fixes, DIYs, over-the-counter topical applications? Do they really work or they are harmful?
That's a really good question because nowadays I'm getting a lot of teenagers who have uh, almost these many products in their kitty. Okay, they get all the products. Doctor, I've been using this, and most of the times, what happens? They say, "Guys, I saw some influencer promoting this product, and I saw her skin was really nice, and then I thought I'll also get such a nice skin." They buy it, they apply it, and then everything goes for a toss. Okay, every single day I get uh, patients who say that didn't have anything on the skin. I thought I'll make it better, and now it has turned out to be even worse. Okay, because there has to be a certain routine that has to be followed for every skin type. So you can't just apply all actives together. You can't apply actives every day. So that knowledge is very important. And I think there's unnecessary what do we say, emphasis on using too many products nowadays. But I feel less is more in skin, especially when they are at a very young age. The skin is very sensitive, like they are not used to so many products, and if the skin is bombarded with so many things, it's going to go for a toss. I would say against garlic as well. I've seen so many burn marks. Okay, they come with deep burns, even toothpaste. Okay, some patients do see a difference, so it's like a quick fix, but there it can also cause burns. So whatever you do, you have to just see ki, is it scientific, and see basin and all, and that is all okay. Okay, that is good for oily skin, but restrict it to that. Don't use anything and everything on your skin. If you have any doubt, there's so many qualified dermatologists, you can take an opinion from them. Okay, and nowadays I'm seeing the trend that kids are coming, they are saying, doctor, please give me a regime for my skin. And that I'm liking because now they're not depending on people who might have some vested interests. So that's a good
Correct.
trend.
And what about those topical applications that we get from, over the counter in a chemist shop? Initially they work wonderfully and we feel कि अरे हमारे हाथ तो एक मैजिक क्रीम लग गया, देखो डॉक्टर के पास भी नहीं जाना पड़ा, तो वो कितना हार्मफुल हो सकता है डॉक्टर?
Absolutely, that's such a good point because most of those creams have steroids. Okay, and they give wonderful result. They see their friends looking fairer and glowing and all. They don't know what it is going to cause later. Okay, they start applying and creams like Becnovate, Clovate, and all of these patients apply, and they have the worst kind of comedonal acne after that. Okay, because that's a side effect of using a steroid cream. So please, my request is do not use any creams given directly by the medical person at the medical store, because a lot of times majority of the times it is a steroid. Okay, see, steroids are good, but they have to be used very carefully and in certain conditions which have inflammation in it. Okay, so we give, as dermatologists, we do give steroidal creams, but that is only for a limited period for eczemas, for psoriasis, and conditions which need a steroid. So we can't have a blanket, we can't give a bad name to the steroid, because those are needed, but not on the face and not for acne. So that's a completely wrong use. And I think in India, the laws are not very strict. Anybody and everybody can just go to the chemist and ask for creams. And that has led to problem of topical steroid damaged faces that we get every single day. So it's a very good point, and do not use any of such creams. Just visit a dermatologist and ask for the right products for you.
Absolutely. Every skin is different. Just like, we have a different life, a different lifestyle, different fingerprints, we have a different skin. So it's important that for our, skin related issue, we should go to the right person. आंखों में अगर कुछ होता है तो हम आई स्पेशलिस्ट के पास जाते हैं ना. अगर चेस्ट पेन हो रहा है तो हम कार्डियोलॉजिस्ट को दिखाते हैं ना, हम ओवर द काउंटर जाके दवाई नहीं लेते हैं. तो प्लीज डोंट डू दैट टू योर स्किन. Doctor, as you said, it's important to follow a skincare routine, but then it's important to keep it basic so that we can be consistent about it. You also said कि आजकल बच्चे आ रहे हैं आपसे पूछ रहे हैं, which is a very good trend. But then there's also this trend कि हमको Korean skin चाहिए, तो हम कुछ 10 step skin routine follow कर रहे हैं, influencers, etc., etc. So, what could be a basic minimalistic skincare routine that we should follow and keep our skin healthy?
So see, Korean skin is for Koreans. Okay, we Indians have a very different. Uh, so
Right.
Koreans have their own issues. The males don't get mustaches, so they beard, so they want that. So we should not compare ourselves. Our skin
Right.
is
Nobody is happy with their own things. They are just want to copy the others. Yeah.
Yeah, Koreans get surgery for their nose, for eyelids, everything. Okay, and we are blessed with such good features, and our skin is also good. It just run behind the color aspect of it, which is not fair. Like, we don't need to do that, because all colors are beautiful. It is just that the skin needs to be healthy. Okay, so the basic skin routine that I tell anyone to follow is, first, use a good cleanser depending on what type of skin you have. So if you wash your face and if you usually feel dry or stretchy, that means either the face wash is too drying or your skin is very dry. So you have to use cleansers which are non-drying, which are good for dry skin. And then use a good moisturizer. So for dry skin, you can use a little heavy moisturizer on the face and add on a sunscreen to it. Okay, that basic is good enough to maintain your skin. At night, just wash your face. You may add one active depending on what concerns you have. Like, if you have any pigmentation issues, you can use azelaic acid, glycolic, kojic acid. But I feel just ask a dermatologist for it and then take a cream and use it, instead of going through so many products online and then just jumping on from one product to the other because you're not happy with what the results were supposed to be and what you're seeing. Okay, it is not always what they show it to be. Yeah. Then, yeah, toners can be used for very oily skin. I don't prefer toners too much, because they have, a lot of them have alcohol and they can damage the skin as well. And in people who have little sensitive skin, in sense that they react to the products, they should use fragrance-free products. And also, the one thing that you should see for every product is non-comedogenic. Okay, it should be non. What are comedones? Comedones are whiteheads or blackheads. So there are creams which, if you use on the face, can lead to more acne. So you look for a non-comedogenic, or it would be written that this doesn't clog your pores. Okay, so look for those words.
Okay. Right. Now, when a patient comes to you with acne, whatever grade or type, are there tests that you normally recommend for the diagnosis of the root cause, or just by physical investigation, you're sure, yeah, that this is the stage, this is the grade, this is probably the cause, etc.?
So when it is usually teenage male patient, we don't do much investigations. We know that this is teenage acne. Their androgens are acting up, which is causing the oil secretion to be more. That's a natural grade. So therein we directly start with treatments. At a young age, I prefer not to give too many oral medicines. It's mainly creams and simple creams like benzoyl peroxide, adapalene, clindamycin, nadifloxacin. These are the basic products which give very good results, but they have to be consistently used. So what happens is if they don't see a result in 10, 15 days, they say the cream is not working. And that is not a correct approach, because the only cream that works that fast is a steroid. Okay. So if you are seeing a miraculous result, that is a steroid cream. And that is what they get used to, because they have used those creams and they see those results. But that is not sustainable. Okay. So that is how we should go about for acne.
Right. And what are the treatment options available, doctor, for acne?
So there are a lot of treatment options available, but mostly I feel we can manage well with only topical and oral medications for acne. We can do, there are certain lasers that work well for acne. Okay, if somebody has cystic acne, like the big ones, then we do give intralesional steroid injections so that they get less, because they leave a big scar. See, the problem is not the acne. The acne will eventually go off. The problem is the scars and the marks that it leaves. Okay,
True.
which is why sometimes parents have this fear of not going to a doctor, because they say कि acne तो चला जाएगा ना, क्या करना है treatment लेके, right? But the scars that it leaves becomes permanent, and which is why I feel acne treatment is essential.
Absolutely. I know those who, have gone through that phase, they'll understand treating acne is one thing, treating post-acne inflammatory pigmentations or, scars or pits, my God, it's another level. It's the bigger challenge. So it's important to address acne to minimize the risk of those scars. Now,
But
for those scars or pits and marks, do you have procedures? What are the procedures that we can go for?
there are a lot of procedures for acne scars and marks. The basics are the peels. We can do glycolic peel, salicylic peel. Even sometimes if it's a very tough mark, a TCA peel. Then there are phenol peels. So there are good amount of peels that can be used. There is also a Q-switch laser for the marks. When there are scars, like there are craters, what is the difference between a mark and a scar? A mark is when there is no change in the texture of the skin. So it's only the darkness or the redness which is seen, but the texture remains the same. Whereas a scar is when there is a depression, there is a, जैसे गड्ढा बोलते हैं ना वैसा. So if there is something that's there, those are scars. Both have to be treated differently, because peels and all are not going to work absolutely for the scars. Okay, I see a lot of patients come saying that I have done a lot of peels for my scars, but that is not going to work. In Indian skin, we can't go to that depth wherein the scars can be taken care of with a peel, because our skin is uh, melanin producing. Okay, so any burn is going to cause more pigmentation. So which is why we have to be more careful. And also one more thing about these peels that you get online. I get so many patients with burns coming with burns because they have used a peel that they got online because they wanted to save some amount of money, but now they've ended up with worse condition. Okay, do not use high concentration peels at home, and because it has to be done under the guidance of a doctor. Now coming on to scars, we have CO2 laser, we have micro needling with radio frequency, PRP, which is platelet rich plasma. Uh, so all of these have to be combined to give a good result for acne, because see, when we get acne scars now, they are not similar. Few of them are few of them are rolling scars, few of them are box scars. So all of these scars respond differently to different treatments. So we have to see what all treatments are to be done, and it is almost like a 6 to 8 months ka pura procedure, wherein we handle the scars. Every monthly we do one procedure, because we need to give time for the skin to heal as well.
ये बहुत एक इम्पोर्टेंट पॉइंट आपने रेज किया डॉक्टर मोदी बिकॉज एक तो है आजकल ऑनलाइन अवेलेबल है बहुत सारे इन्फ्लुएंसर्स हैं आई मीन वी आर नॉट अगेंस्ट एनीबॉडी बट देन दिस इज द ट्रेंड दैट्स गोइंग ऑन हु रिकमेंड वेरियस केमिकल पील्स और लोग घरों पे उसको कर रहे हैं and then we have parlors, we have quacks because quackery is also rapidly increasing, and we have clinics where there is no qualified dermatologist as such, but then they have these things. So my next question to you is how and why it is so important to go to a qualified dermatologist and not for these parlor peels or whatever etc etc because वो जो एक वर्ड आपने यूज किया ना उनको लगता है कि वो थोड़े से पैसे बचा लेंगे लेकिन वो थोड़े से पैसे बचाना कितना नुकसानदायक हो सकता है.
Yeah, yesterday itself, I got a patient. She had this huge burn mark on her hand. And I asked her what happened. She said, I did a peel at a parlor. Okay. And I was like, why did you even think of doing it? She was like, no, it's okay. I was going to the parlor. She said, I'll do a peel for you. And then she did it. See, the problem is, no, when things go wrong, things may go right a lot of times. But when they go wrong, they don't know what to do. Okay.
Right.
Think that the things won't go wrong with a dermatologist also. Sometimes that can as well happen, okay, because everybody's skin is different. But as dermatologists, we know how to handle the problems. So we are taught
Right.
to handle complications, which is why it is necessary to go to somebody who knows how to handle if things go wrong, right? So, so a lot of times what happens is if somebody is going and they are seeing good results with a salon person or anybody, they recommend their friends. And by the time
Mm-hmm.
he goes, then they start seeing a problem there. So then that initially they don't see an issue because a lot of times it does happen. But when things go bad, they go really bad. So which is why avoid going to anybody who's not a qualified dermatologist. So look for MD, DNB, DVD in their degree. So after MBBS, these are the degrees which qualifies us to be a dermatologist.
Right. So it's very important to go to the right person, which is a qualified dermatologist. Now, doctor, because we were also talking about how to keep our skin healthy and what should be the basic, skincare routine. Many times, people who have acne-prone skin or oily skin, they feel that just because I'm producing more oil, I'm having acne, and thus I need to keep my face, completely dry, oil-free. And they keep on washing their face with cleanser, without cleanser, but many times they'll wash their face, or they'll feel that it's the dirt on the face that's leading to more of acne. So, what is the truth? I mean, how many times cleaning your face is okay?
Yeah. So again, that's a very good point because what happens is when you have oily skin, you feel that the more you wash, the better it is. But the problem is if you wash it too much, make it too dry, our, our skin also has a brain, okay? So it will think, okay, dry ho gaya, now let me produce more oil. So what happens is they go and they get stuck in a circle of excess oil production. So what we need to do is 2 to 3 times a day is enough as a face wash. We should not abrade our skin too much. See, our skin cells are themselves able to shed off. Okay. So you will be surprised to know 50% of our house dust is our skin which is shedded. Okay. So that's how much our
Uh,
skin shed. We don't even usko ghisna nahi hai. A lot of scrubbing people do, which I'm totally
हाँ because exfoliation भी बहुत करते हैं लोग and they feel कि it will also keep their face acne free to exfoliate their skin.
too much exfoliation is not good, especially for Indian skin. See, there is difference between. See, what is the difference between Caucasian population and Indian population? It is only the skin. Internal organs सब same है. Okay.
हाँ.
अपने skin में melanin है. Anything very great, there is going to be pigmentation after that. Okay, then whatever they do, even if the skin burns, they'll only get a white skin after that. Okay, they are not going to have skin there because they do not have melanin in their skin. So that is what is the differentiating feature. The products that are good for their skin cannot be good for our skin. The lasers that work for their skin do not work for our skin. So which is why it is essential to know what the skin type is and accordingly only manage our skin.
Right. So it is important to understand that. Now with moisturizer, especially people who have oily skin, they feel that they are already producing so much of oil. Why to, layer it up with more of moisturizer? So normally they ignore that, moisturization part. How important it is to moisturize even if you have oily or acne prone skin.
Yes. So, so after cleansing, what happens is the skin feels a little dry. For some time, somebody who has oily skin, they like that dryness on the skin for some time. Okay. So, which is why they have to put a moisturizer at the same time, but they are damaging the skin even more because they, so if we put a layer of a very thin gel-based or water-based moisturizer, even on oily skin, it will just keep the skin hydrated. It will not cause more oiliness. Okay. And what happens is if you have a layer of moisture or hydration, the skin will not feel the need to produce more sebum. So there we are tackling the sebum issue. So it is actually helping not get more acne. And somebody who has dry skin and acne, so there are people who have dry skin but still have acne. Okay, so that is because they do not have too much oil production, but the problem happens in the keratinization process at the hair follicle level. So the sebum comes out through the hair follicle around it, the pore. So the problem is there. The dry skin, it clogs the pore, and that is how they get acne. So even here, moisturization is essential because that will keep the skin keratinization happening in a better way so that the pores are not clogged. So moisturizer is essential. Yes, I can understand in the Mumbai weather where the summers are really hard. You do not want to layer too many things because you start sweating after that. So in such cases, I tell them use a good moisturizing sunscreen then directly. Okay. So who has a very oily skin in summer, then I suggest you skip the moisturizer but use a sunscreen which is moisturizing. That is also good enough.
Now, as you mentioned, moisturizer, how important is applying moisturizer? Because there are so many complaints, people have with moisturizers, so many excuses for not using moisturizer. Many times, as you said, because in Mumbai the humidity is more, we sweat a lot, and we feel that, moisturizer just makes the condition even worse. I mean, it makes us sweat, it makes us dull. Many times people don't like the white cast, etc., etc. So, how to choose the right sunscreen, especially if you have a oily or acne prone skin? The sunscreen.
So I prefer to give a water-based or a gel-based sunscreen to my patients who have oily or acne-prone skin. And we should avoid ingredients like oil, okay, mineral oil or isopropyl myristate, which is another additive which can cause acne. Okay, so all of these products or the content should not be there in the products which you are using for acne-prone skin, and your doctor would know it. So, which is why it is essential ask them for advice which sunscreen is good for you. Yes, why is sunscreen necessary? Because what happens is acne, because there's inflammation, right? And so acne will go, but it will leave a red scar initially. And that red scar is going to lead to pigmentation. Because if there's too much sun exposure happening, your skin is not protected with a sunscreen, that red mark is going to turn black. So, which is why sunscreen is essential. A moisturizer is essential because, as I told you, it's necessary to reduce the sebum secretion as well. So, both these products can be used and should be used in anybody who has acne.
Right. For sunscreen, what are the basics that we should go for when we are going to buy a sunscreen? I mean, we all know about SPF, but then what are the other things to look for? Because there's so many information on the box or tube of the sunscreen.
So first look for non-comedogenic, okay? Because that is what you need, non-comedogenic or won't clog pores. Second is it should be water or gel based. There should not be any oil in that, okay? Because that is again going to clog the pores. And you can ask for a test, like if you go to a normal shop, they can even give you a tester, or then go like even dermatologists have testers with them, so you can ask for it. You can see how it feels on your skin before buying it, or buy a small pack and see. Most acne sunscreens, no, they have written, like they have actually written inside the sunscreen for the patients to know this is for acne prone skin. Look for that also. If it's written like it's an acne this sunscreen or something which reduces acne control sunscreen, like that.
Right. And doctor, what is the best way of applying sunscreen? How much sunscreen to apply and when to reapply? And before stepping out, how much time before stepping out we need to apply? We would also like you to shed some light on these topics.
Yes. So see, sunscreens, there are two types of sunscreen. One is a chemical sunscreen, and another one is a physical sunscreen. For acne
Hmm.
prone skin, I prefer a physical sunscreen because they do not interact with the skin. They just form a layer on the skin, and that is how they reflect light and they do not get absorbed. Okay. So these sunscreens can be used just before leaving as well because they just form a protective layer. Whereas if you're using a chemical sunscreens, and most of these sunscreens which you get OTC are chemical sunscreens, okay? And if you're using those products, then you have to use it at least 20 minutes before because the sunscreen has to get absorbed in the skin. Then that is when the sun protective effect will come up for the sunscreen. So that is essential. Now, if you're out in the sun, the effect of the sunscreen starts to wear off after 2 to 3 hours. Okay, by the fourth hour, whatever the sunscreen says, it wears off. So if you're out in the sun, repeat an application after 3 to 4 hours because I think too early is not possible. At least 4 hourly you try. Use a SPF of more than 50 if you're going out in the sun, but SPF of 30 is also enough if you're indoor. Okay. And if you're indoor, then just one more application is enough, I feel. You do not have to keep on applying every 2 hourly because it becomes cumbersome. You can even use those sticks that you get uh, for re-application because I feel they are good only for re-application, not like a primary sunscreen.
Mhm. Right. Doctor, there are so many questions that viewers are asking. I'll take them one by one. So we have Nisha, and her question is: can acne be exaggerated by certain sport activities?
Yes. So there are certain sports which can aggravate acne, like when there is too much sweating, or if you have to put something on the forehead, and if you have to wear certain helmets or something, then that can aggravate acne. Also, if somebody is into weightlifting or gymming and they take whey proteins, because whey protein is also known to trigger acne. So that way it can happen. Also, in gym, if you're not careful about hygiene, that could trigger acne as well. So keep a separate towel, keep a towel whenever your face is touching any equipments or when you're sleeping on a mat. So those precautions you need to take. Immediately after any workout or sports activity, you uh, have to wash your face. So that is very important. And that way you can avoid acne with most sports activities.
Doctor, is diet also correlated with acne formation? Any dietary precaution that you would like to recommend? Any do's and don'ts?
So there are studies which have shown that sugar is highly acnegenic because it is a very inflammatory substance. So, see, acne is an inflammation. So anything that is going to increase more, the inflammation in your body is going to increase acne. So, one is sugar. Second is dairy products. Now, dairy products have something called as IGF-1 factor or insulin-like growth factor, which can trigger more acne formation. Also, the cows nowadays, they are given a lot of hormones to produce more milk. Now, where do the hormones go? They'll go to the milk as well, right? And that is what we are, which is why we are loaded with a lot more hormones now. So, dairy products, then sugar, anything which is processed, so which comes out of factory, like even chips and biscuits and all, everything is loaded with a lot of processed food, sugar, salt. These products can also trigger more inflammation in the body. And that is when the acne can, because it's an inflammatory condition, that can also aggravate.
Right. There's one more question by viewer: precaution for oily skin.
So, precaution for oily skin, keep it well cleansed. Okay, use a sebum control moisturizer or a gel-based moisturizer. Use a good sunscreen. And if it's too oily, then you can even consult a dermatologist to get some peels done or a carbon peel done to reduce the oiliness in the skin. So there are medications like retinoids which can be applied or taken orally to reduce the oiliness as well. So these are the things that a person with oily skin can do.
Okay. We have one more question. What can we do for body acne?
Yeah. Okay. So body acne or truncal acne. or trachne, whatever we call it nowadays. So see, as I told you earlier, there are pilosebaceous glands, like the units, which are there on the upper back as well, on the shoulders. So somebody who has acne on the face can also get acne on the back and shoulders. So these need again similar treatment to what we do for the face, but we need a higher concentration of the products because the skin on the back is very thick. So it needs higher concentration. So if I'm giving a 2.5% benzoyl peroxide on the face, I would prefer a 5% benzoyl peroxide on the back, like that. And I prefer giving a body wash as well because that helps. It's very difficult to keep on using stuff on the back. You will need somebody's help. So to make things easy, we either give sprays which can be used, which have anti-acne ingredients like a retinoid or a clindamycin or benzoyl peroxide, all of that. And one more thing which I would like to tell the viewers is that a lot of times the conditioners or the hair mask that we apply can be a cause for body acne. So what you have to do is,
Okay.
yes, so what you have to do is whenever, see, we apply conditioner, we just leave it on like this, okay, and keep it 5 minutes. All of the conditioner is going on your skin. And because conditioner is very sticky, even if you wash it off, the conditioner forms a layer, it doesn't go off. What will happen if there is a layer on the pores? The pores are going to get clogged, and that is when you get acne. Yeah. So what I tell my patients is you have to wash your hair. So when you apply conditioner, you actually put the hair on top like that, and then wash your hair in the opposite direction so that nothing falls on your back or the shoulder any time of the washing period. And then wash your back on the face, and if because if something is left, then that can also be taken off.
Absolutely. Many times people ask that can I apply makeup over acne, and in case that it's necessary, how to apply makeup? What are the things that we need to keep in our mind before applying makeup, especially for acne prone skin?
Yes, so that is a very common question because nowadays everybody wants to wear makeup, even if it's a 12 or 13-year old. So you cannot just blankly say, no, you can't use makeup because that is not how the things are right now. Everybody wants to look their best and have makeup. So I tell them again, while taking a makeup, it has to be a good brand. It has to be minimal makeup. I tell them use lipstick, use a kajal, use eyeliner, more of those things to enhance your features. Keep the skin like a little raw, like do not use too many products. You can use like a BB cream or a tinted sunscreen. So tinted sunscreens also give a good shine on the face. So that is what can be used. Somebody wants to use makeup, then it has to be removed by double cleansing. Okay, so first a oil cleanser has to be used and then a normal cleanser so that all of that goes off and avoid prolonged makeup. So there are certain if there is if an actor comes to me, then obviously I can't tell them that you have to remove your makeup. They have to have it on. But for other people no, who can avoid makeup for longer hours, it is best to not use it for prolonged hours. Remove just use it when you need it and then remove it.
And how important it is to keep the applicators clean, the brushes, the sponge, the puffs.
That's a good point because a lot of bacteria and fungus and anything that can actually grow on those brushes because there's a lot of moisture there. So it is very essential to wash them weekly, keep them dry. I find our fingers to be the best to apply because we can wash, sanitize our hands, and use them. Yeah, and it's easy. It's we don't have to worry about the bacteria or the fungus growing. So keep it minimal, keep it easy. Don't use too many brushes, and unless you are in that profession where you have to. So keep it simple.
And also keep your fingers and your hands clean before you touch your face. Because otherwise, I wanted to ask you this, doctor, as well. Because, ये बड़ा obsession होता है, especially जिनको acne होता है, वो अपने fingers को अपने face से, अपने हाथों को अपने face से दे नहीं रख पाते हैं. And also about popping your or squeezing your pimples, ये कितने harmful हो सकते हैं.
Yes. So see, आप अगर पिंपल को टच करोगे या उसको निकालोगे, that is going to lead to a mark or a scar which is going to be there for a prolonged period of time. And I know it is difficult to control. When you see something, you want to just squeeze it out and remove it. But what happens, आप जब squeeze करते हो ना, तो जितना बाहर जाता है उतना अंदर भी जाता है. Okay, and that it forms a cyst, so it becomes even worse. So keep it to the minimum. Also, I see a lot of patients who like excoriate their acne, and they have these marks, like really dark marks, which we call as acne excoriate. So that is when we have to then talk with the patients, understand their concerns, tell them that what is happening, what is they're actually harming their skin in that way. So it has to be a two-way communication as why they are not able to control it. So we give them other options as how they can control that urge to pop the acne. So it is essential not to touch acne so much. Just the time when you're actually applying a product or washing your face, that is when your hand should actually go to your face.
Absolutely. And doctor, before we sum up the whole session, anything that you would like to tell to our viewers in the end?
So, as I also work on the subconscious mind, I would like to give you a few tips to my viewers. Uh, See, a lot of times we keep on saying, no, I am very sensitive skin, nothing suits me. कुछ भी लगाते तो खराब ही हो जाता है. See, that way we are programming our subconscious to behave that way, because our subconscious doesn't understand true or false, good or bad, right or wrong. It will just believe whatever you tell it. So what will happen? It will become even more sensitive. Nothing is anyways going to suit you then. So don't say that. Say instead, I have sensible skin. My skin knows how to respond to treatment. My skin responds well to treatment. So those are the affirmations that you can give your skin. Because the subconscious mind is responsible for 95% of our life. Okay, that's only 5% conscious efforts we do. Consciously, you're doing all efforts to apply the best products, take everything, and subconsciously, you're constantly saying, nothing is going to suit me, my skin only reacts, nothing is going to happen. Then the 95% is pulling off of your 5% efforts. So always keep your subconscious also aligned to your conscious will, what you consciously want. So what is that you want? You want a good skin. So say, my skin is getting better every day. My skin is getting better with every application. This application is working wonderfully for me. Okay, and that is how the things will keep on happening. The second thing that I would like to say is, do not add my to anything that you don't want. Because whenever you say my acne, my hair fall, my everything, subconsciously it actually becomes yours. Because the subconscious feels, अरे ये तो इनका ही, ये तो own कर रहे हैं ना, you're owning it. So do not
Right.
say this acne, this backache, this headache. So people keep on having 20, 30 years of backache, and they say, this is my backache, my headache, like that. And you're actually owning it. So subconsciously, you don't want to own anything that you don't want. So don't say these things, just say this acne, and do not refer it to as mine. So, and I believe skincare is not only what you apply on the skin, it is also what you consume and how our thoughts are. So I've given an acronym of ACT, ACT. My viewers know it. So what is A is apply, consume, and thoughts. These three things make up for a good skin and good health. So if everything is aligned towards a good skin, then that is when you see the best results.
You have added such a positive element to this whole, conversation. I'm sure it's going to be really useful. Thank you so very much, Dr. Ashwini Modi. It was wonderful talking to you. और वाकई में deep down ये समझना कि किस तरह से पॉजिटिव एटीट्यूड, छोटी छोटी बातें ही होती हैं, लेकिन वो हमारे सबकॉन्शियस में रह जाती हैं और वो हमें अफेक्ट करती हैं, तो इसलिए उसको हम कितना पॉजिटिव बना के रखें ये हमारे ऊपर डिपेंड करता है. थैंक यू सो वेरी मच फॉर joining us and for making this session so informative and interesting.
My pleasure, and you have been a great host. I loved your questions, and they were very relevant. Thank you so much.
Thank you, doctor, and viewers. Thank you for joining us. Stay happy, stay healthy, and take care of your health. And as doctor said, अपने health का, अपने thoughts का भी ध्यान रखो, positive रहो, वाकई में जरूरी है. Thank you. Have a great day ahead. Goodbye.